Welcome back to Coverage by Cassie YouTube channel. Today we are covering part 2 of 10 things you need to ask when finding your health plan. So me, Cassie, as your coverage advisor, licensed health insurance agent, I'm going to walk you through these. So today we're talking about number 2, which is how much will I have to pay for my medical coverage. So when it comes to that, how much will you also pay for your medical care? So it's like a 1 and a 2. So obviously we need to know what will be the monthly premium. Okay, so our monthly premium, fancy insurance speak for, what's it going to cost you each month? Okay, so when it comes to the premiums, it depends on that number 1 question of what plan is it. So on the federal side, those are going to be priced based on your household income and your household size. They do not decide on coverage by your health or any other factor. The private side, those are going to be priced based on a healthy risk pool, which is why you need to be healthy to qualify for those in the first place. That's why you'll get those nationwide PPOs. There's more benefits when it comes to our regular day-to-day. So that kind of leads me into that next part of our co-pays, okay? Does the plan even have them? What's it going to look like when you go to your doctor? Is it going to be a flat fee of maybe $10, $20, $30? Or do you have a deductible to meet first? So it's really important to look at those. If you don't even know what a deductible is, that's something I'm going to go over in another video here. So Coverage by Cassie is going to be your resource for education when it comes to all things health insurance. So I'm your guide. I'm here to make things easier on you and make it as peaceful a process as it can be. So I help people with this every single day. So with this question of how much I'm going to have to pay for medical care and coverage, you need to know your monthly cost. You need to know why it is what it is. If it's not been explained to you in the past, that is unfortunate, okay? You need to know what you're paying for and how it's going to work for you. Some plans out there have $0 deductible. They may have a flat rate when you visit the doctor. Some may have a lower deductible that you meet and then it's free of cost after meeting it. You may have a massive deductible that you have to meet, but you're more concerned with the what ifs, so it's okay to go that route. And costs per month is going to depend and vary depending on every single thing that we talk about. It's why a needs analysis is so crucial when talking with me, your agent, so that I can get a good evaluation of what your situation even looks like before we look at policies, okay? So number 1 was what plan was it? This is part 2 of what's it gonna cost me and why do those costs work the way they do. So again, you're gonna find federal things, you're gonna find work offered coverages where typically the employer will pay a little bit onto your coverage, like 50%, maybe the whole thing. But what we see a lot is when you're adding family members, that cost goes through the roof, okay? So if you're adding a spouse or children, there are other alternatives outside of the federal open enrollment to look at for your family. So keep that in mind, and you've got me, Cassie, as your Coverage by Cassie health insurance advisor. So I'm going to put details to contact me in the bio. Be sure to shoot me an email if there's a way that I can help you and answer some questions that you might have that have come up based on this video and the series I'm doing. So contact me. Be happy to help you guys get in your best situation. And I'm licensed in over 15 states right now. So it's not going to hurt to check and either confirm that you are in your best spot or take a look around, see what's available. I'm licensed through states individually, so I have access to all the good stuff, okay? I don't work in those short terms, which we will do a series on alone for golden rules, Christian health shares, any kind of meta share. So keep an eye out, keep an ear out, because I know I hear those on the radio station often pushing those kind of plans because yeah, they might be cheaper monthly, but in the end, it is gonna cost you big. So touch base with me and look forward to number 3 video coming up, which will be how will I be able to use my current plan to access my current doctors. So that will be our next number 3 of 10, focusing on doctors and being in network. If you don't know what that is, you need to watch that video. So have a great day and we will talk soon.